Hey everybody, it's Dr. Mark Suter, periodontist from Bloomington, Indiana. Welcome again to my drop-in live video. So I hope you all enjoyed my description of how to floss your teeth and how to basically clean in between your teeth. I got a lot of really good questions and a lot of good comments about what you may have not have known, what was new to you, what was kind of a affirmation of something that you weren't quite sure of. So I appreciate your comments. I love when you guys send me questions. So I'm trying to have a nice continuum for everybody on things that we talk about so they make kind of logical sense. So we talked about how to clean your teeth and how to prevent bacteria from growing in between your teeth. Here's what we're going to talk about today, something really cool. Has anyone ever heard of the term salivary diagnostics? What salivary diagnostics means is that we're going to be able to detect disease from our saliva. How cool is that? So instead of taking blood samples, at some point in time, we're going to be able to, your physicians as well as your dentists and other healthcare providers, they're going to be able to take your saliva and figure out your health. And here's a good example. Not in the not too distant future, diabetics are going to be able to test their diabetic levels and their insulin levels through their spit, through your saliva. So I'm going to talk about how we are using that technology in dentistry, how I'm using it for my patients to try to better serve and diagnose their periodontal health and ultimately improve your general health. Remember we talked about how there's a real distinct relationship between your gum disease and your body, the health of your body. Remember, there's so many things that we're learning about the relationship between gum disease, cardiovascular disease, diabetes, the risk for strokes. Some people have reported some low weight or reduced weight preterm baby births. So some women that have really chronic gum disease are unfortunately seeing their babies not coming to full term and being about 10% lighter than they would normally be if their mouths are healthy. So this is really important stuff, you guys. So I'm going to talk about how do we use our patient's saliva as a way to better diagnose our patient's condition and how you should ask your dentist the same question. So we're going to talk about something called oral DNA. So see that right there? Oral DNA. So it's salivary diagnostics, which is that term right there. So think about that term as nothing more than a way that we can test the health of our body through our saliva. And all I do for my patients is give them a little vial of saline, pretty much salt solution, have them rinse it around in their mouth for 30 seconds, spit it into a little vial, we cap it up, ship it off in FedEx, and in 4 days, I get this awesome result that I'll show you that is a graphic result of the 11 most important bad bugs that we can have in our mouth to cause gum disease and cause things like heart disease, stroke, diabetes, atherosclerosis, other systemic diseases as well as even arthritic diseases. Some people believe periodontal disease could be a cofactor in that. So what can this do for us? So there's three ways that I use this test for our patients. The first way I use it is to figure out whether my patients have really bad aggressive bacteria. This test will test about 11 really unhealthy bacteria that if they're present, I know we need to keep working at making our patients healthier. So I'll show you how that works. The second thing is we can literally, through your saliva, this is awesome, we can test whether you are genetically susceptible to gum disease by an aspect called interleukin-1, kind of a part of our body makeup, that if that gene marker is present, then in our saliva, we can tell you whether you have a genetic predisposition to gum disease. That is really important, and I'll tell you how we use that as a test indicator for how we can help people. And then the third thing we can do is, remember we talked a couple weeks ago about oral cancer? HPV, uterine cancer, cervical cancer in women, and HPV being oropharyngeal cancer problems for boys. So this test can literally tell you whether you've been exposed to the HPV virus or whether you have symptoms of having been exposed to HPV. So there's three components. A bacteria component that we can test how much bacteria is in your mouth and which one of those are bad. We can do the genetic makeup, which is, are you genetically susceptible to gum disease? Because that can dictate how we can help you treat your gum disease and what we should do. And then lastly, if you wanted to know whether you or any of your kids had any exposure to HPV, you can do that as well. For $160, a lot of people think that this test is like super expensive. It's not. I'm not saying $160 is cheap, but it's sure easier and less expensive than some full-blown blood panels that you have done in the medical facility, which is several $100s. Here's the cool thing, is eventually people are going to be able to go to any place in the world, any third world country. They're going to be able to take a product like this, and they're going to be able to take people's saliva and be able to do a phenomenal number of diagnostic things for people. Meaning, instead of having to travel to Africa and have all these IV needles and ways to store your blood, ship your blood, make sure it's treated properly so that it can be tested right, you can do that through your saliva. I mean, that is going to be phenomenal, you all, for our health. You know, when it comes to being able to do things well, non-invasively, wouldn't you rather just spit into a vial than you would have somebody take an IV blood sample? I would. So here's what we're going to talk about. So the bacteria that we're going to test, if I have a patient who has gum disease, is we're going to rule out what type of bacteria they have in their mouth, because here's some of the risk complicators: diabetes, cardiovascular disease, stroke, low-term birth weight, and other inflammatory disease like arthritis. So if I have a patient that has a history of heart disease, and history meaning has a familial history with their parents or grandparents or themselves. If they have had cardiovascular problems, say they've had a stent, it's really important that you know what your oral health is and what bacteria are possibly living in your gum tissue. I'll give you an example later of a patient I met who went to Indianapolis and St. Vincent, had a really extensive blood test done, and his doctor, really smart doctor, marked off 3 things on his blood test that were indications of inflammation in his body. And you know what he did? He suggested that he go see his dentist or someone like me to be able to see whether he has gum disease. That's a smart physician, and a physician that really cares about this dentist. So what I was able to do was take this salivary test and be able to see whether indeed he had bacteria that was indicative of gum disease and whether it would increase his risk for inflammatory disease and thus increase his risk for continual heart problems. So his physician was spot on, man. We were able to take that information, send it to his doctor, collaborate. That's really what we should be doing, you guys. Your doctor, your dentist, your ophthalmologist, we should all be working together to improve your health. So if you have doctors or anyone in your care that is unwilling or really unfamiliar with that collegial collaboration in your health, I would honestly seek other treatment. There are plenty of physicians, dentists, all kinds of healthcare providers that get the importance of that. And I'll tell you a perfect example. Most orthopedic surgeons nowadays, they will have you get a kind of a release from your dentist or your periodontist like me before they do your hip surgery, your knee surgery, your shoulder surgery. You know why? There's a higher risk of you having complications with your joint surgery if your mouth is infected. So many orthopedic surgeons now, I get a letter from them and I have to make sure their patient is dentally and periodontally healthy so I can tell them they are good to go for their surgery. That is amazing. 10 years ago, never happened. So here's a quote from the British Medical Journal in November of 2016. It says, periodontal disease with high-risk pathogens of the kind we're going to test have a correlation between arterial atherosclerotic disease, and patients cannot afford to not be tested for the presence of these bacteria. So when that kind of information reaches one of the real significant medical journals, that is really awesome. It's awesome for you as a patient, and it's awesome for me as a dentist, because when I first started, people would categorize us, well, you're a doctor or you're a dentist, and somehow they thought a dentist wasn't a doctor. I'll tell you what, I took a lot of classes with med students. We did our full body anatomy with medical students, and then when we got to the head and neck, the medical students bolted, and we continued to do our anatomy. So we were shoulder to shoulder with our medical students at Baylor. So that's the way it should be, and it's becoming more like that than ever. So that is awesome, because you, as a patient, you want to have people look at your entire care, don't you? You don't want me to just look at your mouth and not care about the rest of your body. You don't want your heart doctor to just care about your heart and not care about the rest of your body. So find people who want to work together to improve your overall health. Those are the real doctors and dentists that are the most beneficial for you as a healthcare provider. So we can do this. If I had a patient who had heart disease and I measured their mouth, remember we talked about ways that we diagnose gum disease? We use that gum ruler and we measure around your teeth. We can take x-rays to see how healthy your bone is. We can test whether your gums bleed when we measure them. Remember we talked about you can brush your teeth, and many times, especially if you're a smoker, you can brush your teeth and not see any bleeding. But the minute that a dentist or someone like myself measures your gums, the pockets, the minute they remove the ruler, within about 30 seconds, if blood comes out, that's active gum disease. And today, that's probably still one of the most prominent things that we find out in somebody it's called bleeding upon probing. So if we lightly measure your gums and within 30 seconds or so you see blood come out, that's not healthy, and you want to get that fixed. So if we see patients that have that and have other systemic diseases, even if they don't have systemic diseases, if we're just trying to help them keep their teeth, because that's what I want to do. I want to keep your teeth forever. If you're living to be 90, I would love to help you keep your teeth till the day you die. So if your gums bleed and your gum condition, you really want to figure out what to do, you can test out these bacteria and know exactly what kind of bacteria are down in those pockets. When I was a resident, we had to do all these crazy things where we would take the bacteria out from under your gum, and believe it or not, we'd put it under a microscope, we'd look at it under a microscope, and we would tell the patient whether we saw bacteria that was moving around. Because if those bacteria moved around, those are the kind that were really bad bugs, and we would tell the patient, boy, you have these kind of bacteria, we need to do something. We did all kinds of things. We would put little pieces of paper down there and try to get the bacteria to grow to it, and then grow them in a laboratory. And long story short, there were a lot of things that we tried to do, none of which are as easy as having you rinse with some salt water for 30 seconds, spit into a vial, and get your test within 4 days. Just no comparison. Technology is so cool that way. So this is a classic report. Hopefully you can see it. Classic report that I would get back from your laboratory, and just simply look at the colored bars and the fact that there's a black bar. That black bar tells us that anything above that black bar is unhealthy. So I'll turn it to where I can read it. So what I tell a patient is, in this scenario, he's got 5 bacteria out of the 11 bad ones that are above that dark line, what we call kind of the saturation point. When they get above that dark line, that typically means there's so many bacteria in your mouth that's really causing you trouble. So our goal is to figure out, how do we do treatment to get these amounts of bacteria well below the dark line, kind of like these are here. Can you see those that are well below the line? We want all the bacteria to be below that line. So here's the cool thing, is never before have we had the ability to be able to really make clinical decisions based on what's happening in your body, just like your physician would when they do a blood test, right? So when you do a blood test, your physician gets this great report of dozens of factors in our bloodstream, and then they make decisions based on that, right? It's a beautiful way to figure out how healthy we are, and then make clinical decisions based on that. Well, guess what? We dentists can do that too. We can do that without even taking your blood. We can do that through your spit. So we can, within 4 days, I can meet with you, or your dentist can do the same thing. This is not prioritized. This is not a kind of only a periodontist kind of thing. Your dentist can do this use the same product. So again, I have no financial interest in anything that I suggest. I hope you all hear that. I could care less about how the company does. All I know is that I've researched it, I've used it, and I've seen the results. So anything that I will discuss with you, I promise you, I've read the research, I've probably used it on patients, if not myself, and I have some opinion about it. So I'm not going to suggest something or talk about anything that I haven't had some experience with. And if I don't have experience with it, I'll tell you. And that's really what I want this video to be. I want it to be a source for you all of honest, good information in dentistry that you can then go to your dentist, go to your hygienist, and get really good information about how you can keep your teeth for a lifetime. Okay, so that's how I would use the bacterial part of this testing. And here's the cool thing: it also kind of gives you a suggested possibility of even antibiotic therapy. So let's say we clean your teeth, or something called scaling and root planing. That could be really common non-surgical therapy that you can deeply clean your teeth, possibly take some antibiotics for a very short period of time, maybe only 7 or 10 days, and then within a few months, retest this and see if these bacteria have decreased in number. And here's the cool thing, you guys. If they improve and they start getting below the line, then we can keep going. Now we have some great information on how you're doing, what we should do, how we should continue your care. It's really cool, right? So to do the most conservative treatment you can, which is what you want to do. You want to be proactive, do the most conservative treatment you can, try to put off surgery as long as you can. But if that information doesn't add up, then you can say, okay, here's what we're trying. We've done it for a year. It's not getting better. Maybe we need to think about some other treatment. So it's a really great way of being able to help you work with your dentist to be able to figure out what's the best treatment for you. Does that make sense? The second thing would be the genetic susceptibility. So here's a classic thing I would do. If you had any kind of heart treatment, I've had a patient who had stent therapy, and we were really trying to figure out how healthy his mouth was. So we did the bacterial test and that genetic test. Because if you're genetically positive, it really allows us to suggest how you should care for your mouth long term. And a perfect example would be if you're genetically positive and you have heart disease or have heart problems, you should really have your teeth cleaned 3 or 4 times a year. And I know for some people that do that, they get it, but there's about over 20 years of data in my field of periodontics that would say if you clean your teeth 3 times a year, you have the greatest chance of not losing your teeth. Most people over that 20-year period of time, on average, lost 1 tooth by properly having their teeth cleaned, monitored, and maintained on a 3-month basis over a 20-year period of time. So we can talk about that. We work with your dentist a lot where we would alternate your cleanings. And the reality is if your insurance only pays for 2 cleanings, they don't care. I hate to say it. Your insurance can care less if you keep your teeth. They really don't care. What they really care about is how they can invest their money every day. Because did you realize they make millions of dollars taking our money, keeping it in the stock market, and not paying you your premium. I'm just telling you, that's the business of it, just the way it is. So don't ever be fooled into thinking that just because your insurance company thinks you should have your teeth cleaned twice a year, that's the best thing you should do. Because I'm just telling you, if you have this kind of condition, it's not. I guarantee you it's not. I've had people for over 20 years that have been on a 3-month schedule like that, especially after we've arrested their disease, that have done phenomenally well. So remember we talked about that laser therapy? I'm going to discuss something called LANAP sometime, maybe even next week, where we can take a laser beam and instead of using a scalpel, and stitches, we can use a laser beam and laser your gum disease away and be able to arrest your gum disease. Because remember, if anybody tells you they can cure your gum disease, they're flat out uninformed. So we can stop your gum disease, we can maintain it, but gum disease is not curable. So there are tons of people who have had their gum disease treated, arrested, and maintained, and they don't lose their teeth at all. Both my parents had dentures. I don't have dentures. So the idea is get it treated early, figure out what's going on, use any test possible. If this oral DNA test is beneficial to help your dentist, your hygienist determine what kind of treatment to do for $160, I think it's a no-brainer because, it's a whole lot more expensive to replace your teeth than it is to prevent you from losing your teeth, right? So here's one other story I'm going to share with you. A friend of mine is a periodontist in Ohio, posted something today where he had a patient in his chair and she was holding up her H1C report, and her H1C was actually lower for the first time in years because she had had some periodontal therapy by that Lannat procedure, that laser procedure, and for the first time her A1C was below, was about 8, which apparently for her was in double digits forever. So her A1C for diabetic control was better after having her gum disease monitored. And the dentist made a comment that her doctor called my friend and said, "What did you do? Because whatever you did really helped her overall diabetic stability." So that's what I'm talking about. It's a perfect example of how getting your mouth healthy can improve your overall health. So oral DNA, remember the term salivary diagnostics. Basically, think about how your saliva can be an indicator for your overall health and your dental health. That's pretty cool stuff. So next week, I think we'll talk about how can that laser actually treat gum disease that may be persistent, that's not responding to non-surgical therapy. And I'll show you some examples and show you how laser therapy can non-invasively help you get better. All right. Hope you all are enjoying this. Have a great day and go Hoosiers. We got some new basketball coach. Gotta like that. See you guys.